In this podcast episode, Bob King explores the widespread health problems linked to modern office work, particularly chronic back pain, poor posture, and low energy. He reframes these issues not as failures of personal discipline, but as problems rooted in the design of our work environments and tools. The conversation delves into how sitting habits, chair design, movement, and workplace ergonomics impact physical health and productivity. Additionally, the dialogue touches on eye health in the digital age, gender considerations in design, indoor air quality, and the broader effects of environmental factors on well-being at work. Bob begins by highlighting the scale of chronic back pain among adults, especially in countries like the United States, where a large percentage suffer from persistent or recurrent issues. Rather than blaming individuals for poor posture or discipline, he emphasizes a clear cause and effect relationship rooted in everyday behaviors and environmental design. Sitting posture, he notes, is a critical factor in back health. Most office workers worldwide adopt a common but harmful posture, hunched forward over desks, often without back support, maintaining this for extended periods. This position, particularly the forward curve of the cervical spine, known as C-spine, places uneven pressure on spinal discs, leading to long-term damage. Referencing Dr. Stu McGill, a renowned expert on lower back pain, Bob shares a personal story about visiting his clinic in Gravenhurst, Canada, while suffering from severe back pain himself. He recounts McGill's approach to patients in chronic pain, including those considering drastic measures like surgery or even suicide. Bob underscores that surgery, while sometimes pursued as a last resort, often results in worse long-term outcomes, citing examples like Ronnie Coleman, who experienced debilitating pain post-operation. The focus, therefore, should be on prevention and environment-based solutions rather than surgery or medication. Statistics around sedentary office work reveal alarming trends. Around 80% of office workers sit for 4 to 9 hours a day, with total sedentary time, including commuting and leisure, sometimes exceeding 15 hours. Prolonged sitting is associated not just with musculoskeletal disorders, but with increased risks of cardiovascular disease and early mortality. Bob explains that the core issue isn't sitting itself, but the lack of movement during sitting. When seated still for long periods, large muscles are inactive, leading to cascading health problems such as poor circulation and venous pooling, which standing all day cannot fully remedy either. Bob stresses the importance of incorporating movement into the workday, advocating for dynamic environments rather than static ones. Sit-stand desks are a positive innovation, but their effectiveness relies heavily on user discipline, which most people lack. Simple, intuitive chair designs that allow movement without complex adjustments are crucial. He tells a revealing anecdote about how most people don't know how to properly use their chair's reclining controls, resulting in locked, immobile postures that contribute to discomfort and poor spinal health. This, he argues, is less a failure of individual discipline and more a design failure. Bob describes his company HumanScale's mission to create chairs that encourage natural movement. The Freedom Chair, one of their flagship models, is designed to be easy to use, allowing spontaneous shifts in posture to reduce spinal stress. Collaboration with designer Neil Differin emphasized removing complicated knobs and levers, instead using occupants' body weight to regulate recline tension, personalized to each user. This counters the traditional one-size-fits-all design approach, improving comfort and reducing musculoskeletal injuries. Real-world evidence suggests that movement-friendly chairs decrease musculoskeletal incidence, though mood and productivity data remain scarce. Bob challenges traditional posture advice focused on holding a perfect position. He explains that static postures, especially leaning forward with a curved spine, are harmful, but sitting upright continuously is also unsustainable. The healthiest approach is to lean back frequently, distributing weight across the chair's backrest to reduce spinal loading. Above all, he argues, movement trumps static posture. Changing positions regularly is key. This insight contradicts many widespread beliefs that adherence to a singular, correct posture is essential. The discussion explores how much human behavior is shaped by environment compared to individual willpower. According to Bob, environment overwhelmingly dictates behavior, since most people lack the discipline to overcome poor designs or locked equipment. Chairs that require complex manipulation restrict movement, while intuitive chairs remove barriers, naturally encouraging healthier postures. Likewise, sit-stand desks rely on conscious effort, which many users fail to maintain. Automating behavior through better design is far more effective than relying on willpower. Physical discomfort, Bob suggests, clearly detracts from cognitive performance. An uncomfortable or immobile posture hinders blood flow and concentration, reducing work efficiency. Allowing freedom of movement enhances comfort and potentially productivity, although hard data on mood and performance are still pending. He shares that awkward or locked seating may paradoxically increase movement, but often in unhealthy, hunched postures that fail to provide benefits. Bob shifts focus to eye health challenges linked to rising screen use. A global increase in myopia prevalence, particularly among children and young adults, correlates strongly with daily screen time. Research shows that every additional hour of screen exposure raises the odds of developing nearsightedness, with outdoor time playing a protective role. Dry eyes and other ocular issues are also debated, with screen proximity and reduced outdoor exposure both implicated. Importantly, recent data suggests that cognitive and emotional stimulation from devices may disrupt sleep patterns more significantly than blue light alone. He briefly mentions practices like the 20-20-20 rule, which encourages looking 20 feet away every 20 minutes for 20 seconds to reduce eye strain. Bob reflects on the challenge of integrating such routines alongside movement and work interval timers, highlighting how modern office work imposes unnatural demands on the human body and mind. He recounts contrasting experiences between working indoors with artificial light and outdoors with natural sunlight, noting how exposure to daylight improves energy and sleep by regulating melatonin production. Bob discusses how most workplace products are designed based on average male measurements, resulting in poor fit and discomfort for women and those outside average size ranges. His company applies a principle of designing for the individual by creating chairs that adjust automatically based on the user's weight and shape. He references a military study where fighter jet seats designed for average body types fit no actual pilots, underscoring the failures of one-size-fits-all design. This approach improves both functionality and inclusivity across gender and size differences. He recounts the development of mesh-back chairs using multi-panel fabric construction inspired by clothing design to provide personalized lumbar support that adapts to each user's back shape. This technology, which earned multiple patents, creates a chair that fits like a custom garment rather than forcing users into a generic shape. This innovation provides a more comfortable and supportive seating experience, regardless of body type, marking a significant advancement in ergonomic furniture. Towards the end, Bob highlights the overlooked issue of indoor air pollution as a key factor impacting worker health. Many office materials, including carpets, paints, desks, and especially medium-density fiberboard (MDF), off-gas volatile organic compounds (VOCs) like formaldehyde, which can cause headaches, fatigue, and long-term health risks. He stresses the importance of ingredients labeling for furniture and building materials, similar to food labeling, to raise transparency and reduce harmful chemical exposure. Mold is also a major concern in buildings, especially in humid climates, leading to toxic exposure that can cause chronic illness. Bob argues that beyond ergonomics and movement, the overall quality of the physical environment, including clean air, natural light, and toxin-free materials, plays a profound role in health. He endorses the use of technologies such as air filters and points to industry trends where leading organizations demand transparency and safer materials for their workspaces. His company has pioneered transparent ingredients labeling in office furniture and advocates for broader adoption across the industry to reduce preventable health risk factors associated with the built environment.